Ireland's health service has admitted patients have probably died as a result of record overcrowding in its hospitals. Hundreds of patients are waiting hours on trolleys before they can be admitted.
It's all hands on deck in Ireland's hospital crisis. These private sector paramedics have been drafted in to help free up National Ambulance Service crews respond to 999 calls and overcrowded hospitals to discharge their patients faster.
If patients don't move out of hospitals to freeing up the beds, it's going to get worse. And that is our role, and it's a vital role that we move patients as quickly and efficiently as we can to free up the beds for those who really need them.
And plenty do. The number of emergency department patients waiting on trolleys is at a record high since nurses began counting them in 2006. Among the worst affected hospitals is University Hospital Limerick. Marie McMahon's husband Tommy died on a trolley at UHL in 2018. He had spent 36 hours waiting for a bed. The hospital apologised to the family, but Marie says the current situation shows the problem hasn't been solved.
It was just traumatic. There were people lying on trolleys, trolley to trolley, people screaming out for a bedpan, people being sick, people soiling themselves, people on their own in absolute agony, no privacy, no dignity, no respect.
One doctor on the front line at Dublin's Bowman's Hospital says the situation in Irish hospitals is life-threatening.
It's very definitely dangerous, and we know that from the fact that patients who attend emergency departments that are markedly overcrowded are more likely to suffer preventable death. So it is undoubtedly dangerous, and it needs to be addressed.
But the health service executive says it doesn't know if people are dying as a result of the crisis.
Have people died because of this hospital overcrowding?
So it's difficult for me to answer that with any certainty. We know from a study done in the NHS that delayed admission to hospital coming through an ED department is associated with additional mortality.
But surely at this stage it is a safe assumption to say that people have died because of this current crisis.
It's certainly very realistic. I don't know if my colleagues...
The health service has put in place emergency measures and trolley numbers are down on last week's. But flu levels are weeks away from peaking, and doctors say Ireland needs 5,000 extra beds to solve the overcrowding problem. Investment is needed, time is needed. For now, patients and frontline workers will continue to bear the brunt. Stephen Murphy, Sky News.